Today's presentation will be a brief version of how to help a student in distress as a staff or faculty member. My name is Dr. Clarissa Green-Anisich, and I'm a staff psychologist at Counseling and Psychological Services on campus. We are often referred to as CAPS. I will be taking you through an introduction of CAPS and the services that we offer students, how to identify signs of emotional distress, how we at CAPS can support you, other important campus referral sources for students in distress, and additional training opportunities if you'd like further training in this domain. So what is CAPS? We are counseling and psychological services on campus, and we provide students with free, confidential mental health counseling that does not go on student records. We are licensed psychologists, clinical counselors, doctoral psychology interns, case managers and social workers, psychiatrists, peer educators, and administrative support. In addition to brief individual counseling, we offer students group counseling, referral services, medication consultation, outreach programs and events. And again, a reminder for students that our services are confidential, they don't go on their record, and are provided at no charge to registered students. Lastly, we offer crisis intervention services. CAPS crisis intervention services are offered to students 24/7. Some examples of crises include when students are facing extreme anxiety or panic, have lost someone close to them, are having thoughts of self-harm or suicide, or have experienced a traumatic event like sexual assault. All they have to do is call our CAPS office line. And if they are seeking support during office hours, they can come directly to our offices in Brotman Hall. If they're calling after office hours, students will be transferred via phone to an off-campus crisis assistant counselor. But either way, support is available to them 24/7. So how can you as a staff or faculty member recognize the signs of emotional distress? You've likely found that in your experiences that while many students will directly open up about the emotional distress they're facing, many will not. In that light, I'll be taking you through some examples of student disclosures of distress or hardship, as well as reviewing some behavioral signs of emotional distress when things are not so clear. So some examples of student disclosures of distress or hardship. Later in the presentation, I'll be providing recommendations of how to best handle. Some of these disclosures are more common, like struggling with anxiety, and others are more serious and will need to be addressed immediately, like a disclosure of sexual assault or suicidal thoughts. Listed on this slide are some behavioral signs of emotional distress that you may observe in your classroom or service area. Things like tearfulness, irritability, difficulties concentrating, struggles with motivation, changes in behavior. Some examples of this is a person who used to have great attendance stops coming to class. Someone you're working with starts displaying poor hygiene, or you see an increase of disruptive behaviors. Other more worrisome behavioral signs of distress can include expression of bizarre thoughts, disorganized speech or extended delays in speech, odd or eccentric behavior. These can reflect a psychotic or manic episode and are also important to address immediately. So, faculty and staff often share that making the decision to approach a student can be difficult at times due to having time constraints, wanting to preserve student privacy, and not feeling confident to approach a student about emotional issues. While these are certainly very real barriers to approaching a student, I believe there are some ways to respectfully address student concerns in a timely fashion in a way that allows you to uphold your personal boundaries. So here are some of my recommendations should you choose to approach a student that you believe is going through emotional distress. Speak to the student in private to help minimize embarrassment or defensiveness. Share your concerns without interpretation or judgment. This could involve briefly acknowledge your observations, saying something like, I'm noticing that, and express your concerns honestly and directly with the student. Show empathy and understanding. It's going to involve listening carefully to what is troubling the student and try to see the issues from their point of view. You can help by exploring alternatives to deal with the problem and uphold your personal boundaries. Involve yourself only as far as you feel comfortable and stay within your professional role. Seeking consultation regarding how to best support a student and making appropriate referrals can help you to addressing a complex student of concern. So when to make a referral to CAPS or another relevant office. So if you're seeing impairment in their daily functioning, this could be an observation you're having, or this could be students' reports of like having difficulties getting out of bed or making it to class. When it's outside of your range or knowledge or beyond your level of comfort, if it's outside your professional role, if the student is reluctant to speak with you, or if you're seeing a lack of improvement over time. You checked in with the student at the beginning of the semester, but you're still seeing it towards the end of semester. That's usually a good rule of thumb to move forward with a referral. So how to refer a student to CAPS offices. So after either a student brings a concern to you, or after hearing a student out and offering empathy, normalizing help seeking can help encourage a student to seek support from our offices. Using language like students I've taught in the past have found CAPS to be helpful, or CAPS offers free confidential support. Really using casual language like counseling or support can be helpful versus using more clinical language like therapy or psychological services can help to normalize the experience. Offering support can be a big help to a student who's ambivalent or nervous about the idea of seeking counseling support. Offering a call or go with them to CAPS when someone is interested can be a huge help. And lastly, mentioning our crisis support. Let them know about CAPS same-day support if they need it, that we're there for them 24/7. It can be important. When I've done this presentation for staff and faculty in person, I often get questions about how can I best refer a student to CAPS over email, that I don't have a lot of face-to-face interaction with my students, and I would love to be able to refer a student via email. In that light, I've composed a sample email. I think that a lot of staff and faculty nail the empathy piece. When they hear about a student going through a difficult situation, is they are able to show empathy. But a lot of times that referral piece is left out of the email. Referring to CAPS or another office can be really important. So here's an example of that. So if a student discloses that they lost their father, this is how you could respond. I'm so sorry to hear about the recent loss of your father. I cannot imagine how difficult that can be. Please take time to be with your family and do not worry about missing class this week. Showing empathy. Some students I've taught in the past have found it helpful to seek support from our counseling center on campus, normalizing help seeking. If interested, you can make an appointment by calling CAPS at. I'd also be happy to walk you over after our next class if you're interested. Offering support. That same number can be used 24/7 if you're ever in need of urgent support. Mentioning crisis support. Please let me know if there's any other support I can offer, showing empathy. So I hope that this can be a helpful template for you to adapt for your class or service area, depending on the situation. So if you ever find yourself unsure about how to deal with a particular student concern or a student in emotional distress. Seeking consultation either from your colleagues, your peers, your superiors can be really helpful, but we are also here for you at CAPS for consultation if it's in the mental health domain. So how you seek consultation from CAPS is you would give us a call and ask to speak with the counselor on call for consultation. You'll be connected to a counselor in a couple of minutes. And during the call, a counselor will listen to your concerns about your student and collaborate with you to determine an appropriate course of action. An example of a consultation call that we've received is perhaps you are reading an essay from a student and they're bringing up personal concerns related to having suicidal thoughts. Giving us a call for consultation would be very appropriate for that situation. We could help you distinguish if this student appears to be at imminent risk of dying by suicide and needs immediate support, or if there are other alternative actions to best support the student. So keep this in mind if ever needed. So for students facing emotional distress on campus, we at CAPS are a resource here for you, but I listed a few other resources that we have on campus that are huge supports in this domain. So I'll just highlight a few and I'll discuss what they can offer students. And on the following slide, I've listed links to all of these programs. So if you want additional information or you'd like to refer a student to these offices, please see the links on the slide right after this page. So to begin, Basic Needs offers students who are undergoing financial instability or having housing concerns, they offer them support. EMAC deals with student accommodations and helps support students who are having learning difficulties. Filing a CARES report can be crucial in connecting a student to other needed wellness resources. Our Dream Success Center can help support students that are being impacted by immigration policy. Not Alone at the Beach is an amazing resource that provides services for students who have undergone sexual assault and domestic violence. They have a confidential campus advocate, so that can be a great place to refer students who have disclosed undergoing those types of traumatic experiences. And lastly, CAST team is a social work team that works under UPD, and they can respond in person if you are with a student that's facing a mental health issue. Things like displaying aggression or erratic behaviors or are experiencing suicidal ideation. You could call UPD and ask for their CAST team to respond in person, their social work team. So I just highlighted a few resources that we have on campus that help support students who are undergoing emotional distress. For more detailed information on these campus referrals, please visit their websites. And lastly, I wanted to take some time to discuss additional training opportunities. Usually this is an hour presentation in length. So if you're ever wanting this presentation of how to support a student in distress facilitated by a CAPS staff psychologist or clinical counselor, feel free to reach out to us at CAPS. This presentation is usually an hour, but it can vary in length depending on your department or program needs. Also, just rolling out this year is a Wellness Ambassador Certificate Training Program hosted by Basic Needs and Counseling and Psychological Services. It's a 4-hour certificate program that helps deepen your knowledge in supporting students in distress and increasing your awareness of services on campus and how to best use them. And lastly, we have mental health first aid offered on campus. It's a more intensive training that provides excellent information on how to support a student in distress and will offer you more skills to do so. So if you're interested in any of these additional training opportunities, please reach out. If you have any questions, feel free to reach out directly to me. If you would like to request this presentation for your department, feel free to give us a call at CAPS. Thank you and best wishes with you supporting your students.